Why does a period become irregular? What kind of treatment should be taken if the period is irregular? Does an irregular period cause problems in conceiving? What should we do if the period is irregular? Today we will discuss these topics in detail. Ovulation is important for conception. If your period is regular, it is assumed that ovulation is happening. Some say their period is delayed, happening every 2 to 3 months. Others say it occurs every month but not on the exact date, sometimes a little earlier or later. Some experience bleeding 2 to 3 times a month and cannot distinguish what is a period. Some say the blood flow is less, while others say it's more. No matter how the issues are presented, each one reflects an abnormal period. So let's begin the main discussion in the video. Before that, it's important to have a basic understanding of a normal period. 1. Menstrual cycle. How many days apart does your period start? A normal menstrual cycle ranges between 21 and 38 days, with an average cycle of 28 days. This means your period can occur as early as every 21 days, or as late as every 38 days. If you consistently have your period every 21 days, that's normal for you. Similarly, if someone has a cycle of 35 days, that is also considered normal for them. However, if someone's cycle fluctuates, such as 21 days one time, 38 days the next, and then 20 days, this is considered an irregular period. Your menstrual cycle should occur at consistent intervals. 2. Duration of bleeding. How long does the bleeding last? Normally, bleeding can last between 3 and 7 days, with an average of 5 days. If the bleeding lasts less than 3 days or more than 7 days, this would be considered an irregular period. Now the question is, how does a period occur? The menstrual cycle is controlled by 4 hormones: FSH, LH, estrogen, and progesterone. First, the hypothalamus releases a hormone called GnRH, gonadotropin-releasing hormone. This hormone stimulates the pituitary gland, causing it to release FSH, follicle-stimulating hormone. FSH helps in the maturation of eggs in the ovaries, which is why it's called follicle-stimulating hormone. The developing follicle increases the level of estrogen in the bloodstream. When estrogen levels rise significantly, the pituitary gland releases LH, luteinizing hormone, which triggers ovulation, the release of an egg from the ovary. After ovulation, the follicle transforms into the corpus luteum, which then releases progesterone. While estrogen initially comes from the follicle, both hormones, estrogen and progesterone, help in preparing the uterus for pregnancy. If sexual intercourse occurs during ovulation and sperm meets the egg, fertilization happens and pregnancy begins. However, if pregnancy doesn't occur, the levels of estrogen and progesterone in the body decrease, causing the lining of the uterus, the endometrium, to dry up and shed. This shedding is what we know as menstruation or a period. If any issue arises at any step in this process, it can lead to irregular periods. Let's now look at why periods become irregular. The reasons can mainly be divided into 2 categories. 1. Physiological causes. 2. Pathological causes. First, let's discuss the physiological causes. Irregular periods are not always a cause for concern. Some common physiological reasons include: 1. Puberty. For girls aged 13 to 15, when menstruation begins, the body may not have enough hormones, causing irregular periods. It is common for periods to occur every 2 to 3 months during this time, and this is not something to be worried about. 2. Pregnancy. When a woman becomes pregnant, her periods stop. During pregnancy, the levels of estrogen and human chorionic gonadotropin, HCG, increase in a woman's body. Therefore, it is normal for periods to stop during pregnancy. 3. Lactating mothers. Women who are breastfeeding have higher levels of a hormone called prolactin, which can stop menstruation. As long as the baby is breastfeeding, about 70% of mothers do not have periods. This is completely normal and not a cause for concern. If a mother is not breastfeeding, around premenopause, typically, women stop having periods after the age of 45. However, in the 2 to 3 years leading up to menopause, periods can become irregular. This happens because the ovaries start to run out of eggs, which leads to less frequent ovulation. Without ovulation, periods naturally become irregular. These changes are physiological and nothing to worry about. Now, let's look at the pathological causes of irregular periods. 1. Thyroid problems. Both hypothyroidism, underactive thyroid, and hyperthyroidism, overactive thyroid, can cause irregular periods. In hypothyroidism, weight gain is common, and this weight increase can lead to a rise in androgen hormones. These hormones reduce the levels of estrogen and progesterone in the body. When estrogen and progesterone levels drop, periods become irregular. 2. Prolactin. High levels of prolactin in the body can create an imbalance in other hormones, leading to irregular periods. About 30% of women with irregular PCOD, polycystic ovarian disease in PCOD, many small cysts form in the ovaries, which release androgen hormones, male hormones. These hormones prevent eggs from maturing properly, leading to a lack of ovulation. Without ovulation, periods become irregular, and in some cases, conceiving can become difficult. I will create a detailed video on PCOD in the future, inshallah. 1. Premature ovarian failure. Normally, women stop having periods after the age of 45. However, if someone stops having periods before the age of 35, it is known as premature ovarian failure. This can be caused by chromosomal abnormalities or genetic issues. 2. Infections in the uterus, such as PID, pelvic inflammatory disease, or endometriosis, can cause irregular periods. These infections may also lead to pain and bleeding during intercourse. Additionally, tumors in the uterus or ovaries can also cause irregular menstruation. 3. Birth control. Many women use various birth control pills or methods, which can cause fluctuations in hormone levels, leading to irregular periods. 4. Lifestyle. Irregular periods can also result from lifestyle factors such as significant weight gain or loss, stress, depression, lack of sleep, poor eating habits, or iron deficiency. These can disrupt a woman's menstrual cycle. 5. Excessive exercise. Overexercising can lead to irregular periods. What to do if periods are irregular? Menstruation is a natural process, but if it becomes irregular, it's a sign that something might be wrong with your reproductive system. If your period is delayed and there's a possibility of pregnancy, take a pregnancy test 10 days after the missed period. If the test is negative, consult a gynecologist to determine the cause and receive appropriate treatment. It's important to remember that irregular periods are not a disease, but a symptom of an underlying issue. With proper treatment, the problem can be resolved, inshallah. Does irregular menstruation affect the ability to conceive? Yes, since many factors contribute to irregular periods, it can affect the ability to conceive. However, with timely diagnosis and treatment, pregnancy is possible, inshallah. Does irregular menstruation affect the ability to conceive? Yes, since many factors contribute to irregular periods, it can affect the ability to conceive. However, with timely diagnosis and treatment, pregnancy is possible, inshallah. Focus on lifestyle. 1. Diet. What, when, how, and how much you eat are all important. Junk food, processed food, packaged food, and food in plastic containers harm your health, contribute to weight gain, and cause hormone imbalances. It's essential to exclude these from your diet and focus on eating natural and seasonal foods. 2. Manage stress. Excessive mental stress and depression cause the release of steroid hormones, which can disrupt the balance of other hormones in the body, leading to irregular periods. 3. Adequate, quality sleep. Sleep plays a crucial role in regulating periods. 3 important factors to consider are when you sleep, when you wake up, and the quality of your sleep. Different hormones are released in the body at night and during the day. If you sleep late at night and wake up late in the morning, it can confuse the pituitary gland, causing hormonal imbalances and leading to irregular periods. 4. Menstrual hygiene. It is important to maintain cleanliness during menstruation, use sanitary pads, and bathe regularly. Failure to do so can increase the risk of infections in the uterus. 5. Maintain physical activity. Regular walking, exercise, and yoga can help improve both physical and mental health, and also contribute to regular periods. I hope today's video was helpful for you. If you find the video helpful, don't forget to share it with your friends. Please subscribe to the channel to get health advice, health awareness, and reproductive health-related videos. And remember to become a member of our family. Stay with us, healthy and safely. Thank you for watching this video.